Hello, and thank you so much for joining us on this podcast today. We don't take it for granted because we know that you could be doing so many other things with your time. Now, a couple of weeks ago, we featured a young man on the program, Brian Chishimba, who was recovering from junta addiction. Since then, we've received a lot of feedback. There are so many families that have been in touch, sharing that they too have somebody in the family, a child, a sibling, a nephew, a niece who is also going through the same problem. It's actually a big problem in Zambia. And this has prompted a number of people to come together to try and heighten the campaign against junta. One of those people is actually Dr. Christopher Kalila, who's joining me on the podcast today. Hello and welcome.
Thank you very much, Dr. Dora, as this program is popularly known as.
Yes, and it is good to see you after a long time.
Yes, after a long time. I remember the good old days, so to speak, when we sat and in our other lives,
yes.
I must say. Yeah, so it's good to be on this program.
Well, here you are not wearing your hat, so to speak, from Parliament, but that you're part of a group calling itself a coalition in the campaign against junta. Tell us a little bit about that.
Yeah, so thank you very much. So I lead a social enterprise that is known as the Coalition Against Illicit Alcohol in Zambia. Mm-hmm. So as you know, a coalition simply means a group or a collection of like-minded organizations and individuals coming together for a common cause. Mm-hmm. And in this particular case, the common cause is to fight illicit alcohol, which is so rife and rampant in terms of consumption on the Zambian market. So basically that's what we are. And I'm privileged at the moment to lead this coalition as my contribution to society, a humanitarian cause outside what I normally do.
Now, most of the time when we hear about this alcohol problem, especially among young people, we seem to get an idea that this is a Lusaka problem. How widespread is this problem?
Yeah, so harmful use of alcohol, particularly illicit alcohol, is actually widespread. It's not only in Lusaka, as many people believe, it's actually widespread. In fact, it's a global problem. And Zambia is not an exception. And so when we talk about the consumption of illicit alcohol, we are talking about the harmful use of these substances, particularly in spirit form, high alcohol content, packed in smaller packaging, usually 200 mils or 300 mils less.
Let's just unpack some words there. First, illicit alcohol.
Yes.
What does that mean?
Okay, so illicit alcohol simply means that any alcoholic beverage that is produced outside the legal framework, that's number one. Secondly, does not conform to standards of safety and health. So basically, that is the definition of illicit alcohol. And most of it is either smuggled in the country, manufactured in the backyards, through in enhanced sanitary conditions, usually with little access to clean and safe water and sanitation. Some of it is actually counterfeit and falsified. And then you also have the popular ones, which are made in most of our compounds, shanty compounds, villages, known as kachasu, and other forms, including the recent one, which is reported to have killed so far more than 25 people, known as chijavi. So this is a concoction or mixture of methylated spirit, yeast, and also shoe polish. So basically, illicit alcohol, as the word itself means, is something that is outside the legally allowed produced alcohol, especially in spirit form or even brute form, I must say.
Now, I
So-
know you're a doctor yourself. How harmful is this alcohol to the human body?
First of all, it's very harmful. I mean, I've just indicated to you that we have had in the recent past the
Deaths.
loss of life. So actually it can kill. It affects the health of the individuals. And in fact, if you go to Chinaman now, you will be informed by our colleagues there that more than 50% of the cases that they attend to at our highest mental health institution are due to alcohol disorders, and most of it illicit. Apart from that, those that are admitted currently, if we went there, you and me, we will be informed that 40% of the bed space occupied there are due to these alcohol disorders. Again, most of it by being occasioned by illicit alcohol. Apart from that, our colleagues, that is Professor Goma and team, through a research institution or think tank which they run, known as the Center for Primary Healthcare Research in Zambia, attempted last year, in fact, not only attempted, but did carry out a research to try and understand the scale of the problem in the Zambian market. And they found that this consumption of illicit alcohol is very rife and rampant, not only in Lusaka, although the study was done in 3 cities, Dora, Livingstone, and Lusaka, but we can use that window to generalize.
What kind of findings in terms of demographic
graphics and
groupings?
so on. Exactly. So first of all, the findings were that 71% of the people that they interviewed actually consumed illicit alcohol.
So there's a 71% prevalence
Exactly,
rate.
if you look at that. Then secondly, most of it were young people between 18 to 44, but we also know from our other colleagues who are working on this, from the Churches Health Association of Zambia, that in fact consumption of illicit alcohol and alcohol in general has been noted to go as low as 13 and even 9 years in schools.
In
Okay?
schools.
Also, they are working on that, and their findings are yet to be published. Apart from that, the study also showed that most of our consumers of illicit alcohol have health problems because 20% of them reported having visited a health facility as a result of the consumption of this alcohol.
Now, I've heard stories of marketeers who, even before they go to the market early in the morning, they say they will take a junta or something. It gives them energy, then they can stay awake. What is driving this? Is it hardships? What is driving this increase?
Yeah, so also, if you talk to the experts, you will discover that, in fact, when you look somewhere around 2010, the contribution of alcohol disorders to mental health was somewhere around 15%. But you see, over time now, we are talking about 56 and above. So meaning there is an increase in the number of our citizens that are abusing alcohol, especially illicit alcohol. And
Was the
most of
study
them-
limited only to illicit alcohol? It was alcohol across the board.
You know, but for the study by the
Alcoholic beverages, yes, by
by
Professor Goma.
Professor Goma was limited mainly to try and understand the scale of illicit alcohol. But there are other studies that have been done by the Ministry of Health, also to look at alcohol in general, the consumption of alcohol in general. And I think there's one study that was done around 2017 that tried to understand the prevalence of non-communicable diseases. So non-communicable diseases are those diseases that you don't necessarily contract from person through an infectious agent, but you develop them. And these are diseases such as cancers, such as hypertension, such as cardiovascular diseases, and also epilepsy, injuries, accidents, etc. And at the root of these are 4 factors. One of them is alcohol, unhealthy diets, sedentary lifestyles, or lack of exercise and tobacco use. So you see, in order to understand the contribution of alcohol, they needed to know how much of our citizens are actually abusing alcohol. And they found that alcohol use in the Zambian context,
It's very high.
yeah, but it was reported to be around 20.7, simply because they did not enroll in the study. They only enrolled in the study those that were 18 and above. You see that?
Okay.
So they excluded a good number of some of our young people, assumably under the impression that perhaps it was an adult phenomenon. But Professor Goma's study has shown that, in fact, and also the work that Charles is doing, that this problem is actually very rife among
a lot
our
of
young people and a lot of our young people.
If you go to other countries, you will not see somebody walking around with a bottle of alcohol in their hand, and even if when they buy it from the supermarket, they must cover it in a khaki paper bag and so on, so that especially young people are not exposed. Could this problem be related to laxity in terms of laws, legislation?
Exactly. Yeah, so Zambia has very beautiful pieces of legislation and policies around harmful use of alcohol. Okay, the national alcohol policy is one of the best, acclaimed to be one of the best. This was launched in 2018, and by the way, it was actually announced by yourself at the time when you were Minister of Information, and it was launched then by Vice President Inonge Wina. So if you look at this alcohol policy, it's a wonderful piece of document that looks at the whole range of alcohol issues, from production, that is manufacture, distribution, sale, and consumption. And then there is also another piece of law, that is the Liquor Licensing Act, number 20 of 2011, okay, which was passed at the time when you were also in Parliament. If you look at these two pieces, they take care totally many aspects of alcohol abuse, right from production all the way to consumption and so on. And one of the tenets in there makes it an offense for you to be consuming alcohol in public, or to move around with a bottle of beer all over and people are seeing you. So the enforcement part is one that is very weak generally in our laws. We do have sufficient laws that deal with all these matters that you have raised, but what is at variance the fact that the enforcement is very weak.
But
secondly,
in other countries too, when you come to enforcement, it's around what are called values, family values. Have we lost something? For example, the story in the southern province of Zambia where over 25 people died. There have always been local brews in villages. How are we moving now from the traditional local brews to adding shoe polish and methylated spirit? Have we lost something at a family level?
So to some extent, you could be right. I mean, there are many social scientists and other experts who feel that as a country, in terms of rapid urbanization and also population growth and to some extent poverty, has resulted into a loss of some of our social fabric and family values, as you have said. But there are also many, many drivers of harmful use of alcohol. Okay, as I've indicated, it's easy availability or access to alcohol, especially illicit alcohol, because it's cheap.
So again, we are talking now production.
Yes.
There are rules and laws, regulations around production. First of all, where's the source in terms of illegal importation? And then also in terms of these, the production. For example, junta itself, let's talk about it. Should banning of junta be the ultimate solution?
Actually, I always tell people that junta, which is nothing but high content alcohol by volume, if you recall, at one time we had tujirijiris, which was very rife. These are spirits packed in sachets, they are high alcohol content by volume, and they were very rife around all over the place. And if you recall, Professor Luo, who was then Minister of Local Government, banned this type of packaging for these high-content alcohol spirits and did away with them. But they resurfaced in another form through small bottles, okay, which we are now calling junta. So as far as I remember, the ban has never been lifted. It's just that there's weak enforcement. Even the Liquor Licensing Act, it actually prescribes that no person should sell alcohol unless they are licensed. It also prescribes where or what type of premises you're supposed to sell alcohol. In fact, Dora, it says that alcohol should not be sold in a premises that is within 300 meters away from a school, a church, or a health facility. But you tell me now, all these liquor shops all over in the residential areas, near schools, in the streets, near health facilities, near churches, are they licensed? Certainly not. Again, it's enforcement.
Is the problem an awareness gap, first by families, communities, or just that these young people, I did read a report, I think also by Zambian, that the ones who are most susceptible to these issues, mental health, and if it is being driven by also alcohol abuse, are young people, people who are unemployed, peer pressure, poverty, sort of coming from poor families. So are you saying that this awareness to say no matter what problems they have, but the risk to their health is even higher? Or have they just lost hope?
No, precisely. So you categorized clearly some of the drivers of illicit alcohol intake, which I was going to run through. So poverty, readily availability, peer pressure, etc., etc. Okay? Yeah. So now when you look at all this, it is harming the future of this country.
Of this country.
And when you look at the statistics and the figures, certainly we are sitting on a time bomb. Unless we do something about this, we're going to produce a very sick nation. You know, as a country, our aspiration is to be a prosperous middle-income nation by 2030. And all the plans are elaborate and enshrined in our development plans, in our laws, etc., etc. But unless we deal with this issue of harmful use of alcohol, particularly illicit alcohol, we are not going to attain that status. So the starting point is to raise public awareness around the harmful use of alcohol and especially illicit alcohol. What does illicit alcohol do?
Let me get it first very clearly from you. Your organization, what do you intend to achieve?
Exactly.
This is the coalition against
illicit alcohol in Zambia.
So what exactly do you want to achieve? I recall hearing when I was much younger that President Kaunda actually one day banned alcohol completely in Zambia because he said people were drinking too much. I'm not so sure the facts around that. Is that the extreme you wish to see?
Not exactly. In fact, I do recall that it's written and recorded that Kenneth Kaunda actually threatened to resign, not necessarily to ban, because he noticed that Zambians had taken too much to the bottle, and it was going to affect development of the nation, which is exactly what I've said, that illicit alcohol, first of all, has an effect on an individual, health of an individual. I've just given you the grim picture from our highest mental health institution. Apart from that, 53% of the people who consumed illicit alcohol failed to function at work when they went to work. So you can imagine the toll that it takes on the productivity of a country. Okay? Apart from that, if we don't do anything, it means that we cannot realize our aspirations in terms of developing as a country. Now, here is where we come in, just to answer specifically your question. Because of the fact that no single entity acting alone can hope to win the fight against illicit use of alcohol, it therefore goes without saying that you need more players. You need a multi-sectoral approach to defeat or indeed even to reduce this scourge. So you need, on one hand, government, who are the crafters of the national alcohol policy, which is very beautiful, and has all these tenets, except it has hit a snag in as far as we are concerned, implementation. Okay? Secondly, the enforcement of the laws. Government has done its part by enacting these laws, but they need to go further by ensuring that they scale up enforcement. But apart from that, you need other players. You need journalists and media like yourselves to create awareness in the nation around the harmful use of alcohol on the individual's health, on their communities, on their relationships with others, on the national development of a country.
We will just follow up on what exactly the programs you are doing in the community when we come back from the break. But the facts are really, really disheartening. 71% of the alcohol on the market is illicit, and that 56% of those who were part of the research by Chainama Hospital confirmed that they failed to function because they were junta addicts, basically. But we'll hear more details about what the coalition against illicit alcohol is doing in our communities. We'll be right back. Thank you for continuing to watch the program. Now, you were telling us about the programs. Exactly what programs are you doing in the community?
So before I do that, it's important to notice that to defeat this scourge, you need to fight it a multi-sector approach. So you need civil society, like us. You need government on one hand. You need media and journalists on the other hand. You need traditional leaders. You need church leaders. And you need researchers and academia. So you need this. So our side is from civil society. We are a social enterprise organization registered by PACRA as a not-for-profit organization, whose principal aim is to take a stand against illicit alcohol by galvanizing the community through awareness, to stop the sales of illicit alcohol, to make people aware of the dangers on their health, to make people aware of the dangers of illicit alcohol on the economy as well. Because, by the way, Dora, the fact that this illicit alcohol is being manufactured through unauthorized means or imported into the country, it's reducing the tax revenues that otherwise would have been collected by government through legitimate producers. So, as a civil society organization, we simply partnering with government, and our role. You see, the whole subject of harmful use of alcohol is broad and big, cannot be discussed in 40 minutes, because it has many facets. We have only taken the facet of illicit alcohol. And through that, our principal aim is public awareness around the dangers, public awareness on what could be done about this, and asking citizens to take a stand.
I know you have a campaign,
no. Yes,
Rise,
so I was coming to that.
And Stop Junta.
So one of our flagship programs up until now, we only started early this year. We are barely 5-6 months old, and we believe that we have started, we've hit the ground running. So how do we hope to achieve awareness around the communities? So it's through campaigns, such as we have recently launched the Junta Trap campaign to try and get citizens to understand the harmful effects of junta and to take a stand to say no. And those that are already hooked on it to be helped by their friends and
do you
others.
Think citizens are bothered? You hear of bus accidents. Everybody who got on that bus can see that the driver is drunk, the conductor is drunk. These are maybe 65 people on a bus, no citizen arrest, and they entrust their lives to the drunk driver, to the drunk bus conductor. Do you believe the citizens are really engaged, bothered with this campaign? Do they see alcohol in Zambia, alcohol abuse? Do Zambians see it as a problem? They
do, Dora. I mean, our experience through the Junta Trap campaign is that when we launched it, we actually launched it from City Market there. And a lot of the young people who came to us, in fact, most of them were saying, look, this thing, I lost a brother, or we have this problem in my family, and this is a big problem, why don't the government just ban it? Why can't they just seal all the loopholes through which all this, in other words, limit access or stop access? So most of them, and also the campaign has gone round. It's coming to an end in the next 4 days, and then we'll go to part 2, at which we hope to target the actual, the retailers, the people that sell this. And most of so far, the respondents or the people whom we have interacted with, all of them agree that this is a vice that needs to be nipped in the bud, and all say we need to find a way and means to ensure that government takes draconian or drastic steps beyond what is currently subsisting, and that is banning.
Again, I'll ask you and challenge you. I have traveled this country, and I know, especially when there's the so-called football, especially the European League, the British League, you find in all these places around the country, not just in Lusaka, but everywhere else around Zambia, that young men, young women, their business is coming to Lusaka to say they've gone for orders to come and order all this illicit alcohol, and that's what is being sold around these small taverns where people are watching football. How are you going to dismantle that culture that has become so synonymous between football and alcohol?
Yeah, so for us as a coalition, we believe that the cost of inaction, the cost of doing nothing
is high.
So we want to bring together all those that are concerned about this vice. We believe the bigger, the better. We don't want to give up. Precisely what you are saying. We all can't afford to give up. So we think that we need people to amplify voices, just like you are expressing concern and making these observations. We need so many people to come on board to begin to speak to neighbors, speak to families, speak to communities, to the whole country in a multi-sectoral fashion to say, look, we now need to change mindsets. We can't continue to sit when we see that this is causing problems in our families, in our relationships, in our friends. Let's do something about it. Let's work together. Let's stop it. Let's change. Let's go to schools. Let's go to colleges. Let's go to all these youths so that it does not become an entrenched culture and lifestyle of belief that because you are watching Manchester United or Liverpool, then you must, as a matter of fact, you must drink junta. No, junta is going to kill you. It kills, as we have seen. So it's about, for us, it's about saving lives. It's about creating a social movement with your support in the country.
How do you see yourselves working with the authorities in education? Because clearly the idea that keeping a child longer in school is probably a better way to, reduce their exposure. And yet, we saw from Branch Shimba, who was here a couple of weeks ago, that it's actually from school, a boarding school, that it was actually introduced to Jili, to junta.
Yeah, so as a coalition, we want as many players from different sectors of our endeavors as a country.
Have our school system become relaxed over alcohol?
So our school system, or the Ministry of Education, as a matter of fact, our next business meeting, we are inviting them to come to the coalition meeting so we can raise these issues with them so that they can also become proactive and realize that our school settings are not immune or safe from initiation or introduction of illicit alcohol consumption, as we heard from Brian Shimba when he appeared on your program. So we need everybody. We need the Minister of Health, we need the Minister of Community, we need practically almost all the ministries in government side. But we need also other players, parents themselves, the parent teachers associations, they need to be galvanized. So this public awareness is big. And we think that we are just at the starting point with the Junta Trap campaign, but we intend to go further in the community. We intend to use a multiplicity of methods to reach out to as many people as possible. We need a grassroots movement.
One of the problems that many parents have shared with us is that, yes, we know our child has a problem, or sometimes not even children. I had a woman call me who told me that her brother in his 40s is still an alcohol addict and is causing a lot of problems in the family. But they say, They don't know where to go. Is it just Chinama? Are there rehabs centers in Zambia, private or government owned? And that in the private ones, it's sometimes too expensive. One mother told me that she actually feels her son died because she could not access a rehab center. When she tried one, I think in Kafue or Livingston, they said they don't take children over 21 years old. So you want this campaign, but those who are already addicted need some rehabilitation, some medical interventions. So are you pushing for that?
So exactly, as a coalition, we have observed the limited access to treatment and rehabilitation services for those that are already affected, those that are dependent on alcohol, or what they now call alcohol use disorders. So you are quite right that this is observed, even in the alcohol policy, it is clearly stated like that. So as a coalition, having observed this gap, we have actually at the tail end of mapping the rehabilitation or alcohol treatment services that are available in the country with a view to linking those of our citizens and their family members who are afflicted and do not know where to go. But here is the sad part of the story. Since the harmful use of alcohol or illicit alcohol is very rife and rampant and is fueling mental health issues in the country, you know, currently we do not have in the country a government-supported rehabilitation center. Not even Chinama has one. And the great majority of our afflicted citizens are from the poorer communities.
Brackets, yes.
So the only places where they can go to are the government institutions, like Chinama and the other psychiatric units which the Ministry of Health have now set up in the
every new hospital
that they're building and others. Now, they are only at the beginning side. What is available mainly as rehabilitation center is by the private sector. And as you have said, these are quite costly, ranging from 4,000 to 8,000 or even more per month. And rehabilitation takes time, ranging from 6 months to 1 year. So you can't...
6 months to 1 year.
Usually, you can't rehabilitate an alcohol use disorder patient in 1 week or 2 weeks. Like what is happening, many go to Chinama, they are stabilized, then they are discharged back into the community.
And they relapse.
Then they relapse, then they go back simply because our colleagues and friends at Chinama institution are hardworking, they know what to do, but they are limited in terms of infrastructure and facilities that are beginning to, especially rehabilitation centers. So they will only link you up to the private one. Even ourselves will link you up to Chinama or the private ones. But as I've indicated, how many of our citizens can afford the private care? So this is one of the big gaps that we have observed, and we believe that through engagement,
you are coming from Parliament yourself. Yes. You are part of this coalition. You are a medical doctor, and you are coming from Parliament. Are your colleagues at Parliament energized on this matter, that you must actually allocate resources for rehabilitation centers, or we are waiting for a donor to come through to come and fill the gap? So are your colleagues energized on this matter?
I would like to believe that they are, judged by the last debate on the application of values and principles. By the way, Dora, every president that has come to the National Assembly since 2016 to give a report to the nation on the application of values and principles has alluded to the increasing alcohol abuse in the country. So meaning that this is a problem that has reached the highest political echelons in our country. And also, on 15th March, I do recall, when His Excellency, the President of the Republic of Zambia, President Hakainde Hichilema, came to deliver his address to the nation on the values and the principles of our nation. He did allude to this fact and went further to say that we need to stop this henceforth. So I would like to believe that as a lawmaker and also as a private citizen, through this coalition is my contribution to trying to heed the call by His Excellency, whom I must commend, because that shows high-level political will. But we would like to see more from other players. What are they doing also?
Schools,
And all the churches, the traditional
families.
leaders, the families. We need to see more. And that's why we are calling it a coalition. We want more to join us, and it does not disturb what they do in their chosen spaces. It's simply a platform to join hands together to fight a common vice of illicit alcohol consumption. And we saw during the same debate a heightened level of debate from almost all the members of parliament. Each and every one of them was able to tell a story from their constituencies on how our young people were abusing illicit alcohol, ranging from drinking methylated spirit, which you know causes blindness, to junta, and to all these kachasu, etc., in the compounds and the townships and in the villages. So I can safely say from that angle that as members of parliament, we are all agreed and in unison that we need to do this. And I made a debate
alcohol
myself.
abuse goes with drug abuse, marijuana, and
All
others.
those. Yeah, so in fact, some members went further to talk about substance abuse that bordered, of course, on marijuana and including hard drugs, which is another story for another day for those of our colleagues in that space. So I'm also aware that year in, year out, there has been a pronouncement to build a government rehabilitation center, I think through the Drug Enforcement Commission and others, but up until now, this has not been done. So we hope that through these heightened campaigns, through this dialogue and discourse, thanks to Diamond TV, thanks to you, Dora, we believe that we can reach out to so many people. We can now create a discourse in the nation, a narrative to say we need to do something, right from production all the way up to consumption, and also to those that are affected, that they need to be treated and lead useful lives again.
A concern for programs such as yours, organizations such as yours, the Coalition Against the Abuse of Illicit Alcohol, is that depending on who's funding it, is it sustainable? If it's donor-driven, is it 5 years, 10 years, and that is the end of the program? Or because you are coming from Parliament, are you hoping to get homegrown financial support for your programs so that there's sustainability? Because from the numbers, from the research done by Professor Ngoma, it's frightening if you say 56% of the people who were part of the research were non-functional. They couldn't go to work, they couldn't go to school. That is frightening in terms of national vision.
Yeah, so certainly sustainability for any organization is very important for them to continue for a very long time, to create impact which can be measurable, and to ensure that the narrative goes on and on. It requires money, it requires human resources, it requires programs, as I'll highlight some of the programs that we want to do. But I want to point out to you that this is a homegrown organization, as our own way of contributing to government effort to try and stop the consumption of illicit alcohol, because doing so saves lives. But we also know that there will be challenges. That is why we've started with what we consider to be the softer aspects. Public awareness does not necessarily require a lot of money compared to those that are programming in terms of building rehabilitation centers. So we have started with creating a social movement around the country by speaking to various people, appearing on media, as we are doing, thanks to your support. We are in the process of identifying what we call brand ambassadors or celebrities to use their influence around by talking about these issues. We are hoping to have a presence at mass gatherings, such as traditional ceremonies and so on, maybe mount a gazebo or a tent, give out leaflets, pamphlets, talk to people, get them to sign up to some pledge. By the way, we have a charter so they can join. Even you can join this fight. So we think that does not take a lot of money. I'm perfectly able to use my car like I have come here. I can go to Likumbi Liamize in Zambezi. I can go to Chipata, to Nchwala, and so on. I can come to the media. But we want more people to do that. We want more people to do that. The Junta Trap campaign, as I said, the first part is coming to an end, but it was a public awareness too. So we think that way we can start. However, we are hoping that along the way we can partner with private sector. By the way, the private sector, those that are in the production of alcohol, are also part of this coalition.
Like Zambia breweries and
They are also part of this coalition, Zambia breweries, DGM, etc., because it's part of their corporate social responsibility, and they promote drinking in moderation and responsible brewing, as opposed to rogue brewers who evade tax, who smuggle, or rather rogue distilleries who smuggle in the stuff of those that make in the backyard, in unsanitary conditions, and fake these products. So we are hoping, in fact, we are already in advanced discussions. They are ready to support us. They have indicated that they are able to support our work because they believe that this is noble work that we are doing. That the bigger, the better. So we want more players in the private sector, government, civil society, churches to join the coalition. All they are bringing to the coalition is their comparative advantage. If they are in the church delivering messages around illicit alcohol, we are happy about that. If it's the traditional leaders who are the custodians of our culture, customs, and norms, inculcating those values which we are talking about, and they become part of the coalition, we are happy about that. If the academia, researchers producing data for us, evidence to show which can help us to improve programming and policy, we are very happy about that. We believe that's the right way to start. All these things can be done with homegrown solutions, homegrown brains, even the money to do this. We don't necessarily need.
Let me ask you maybe a final question. We are still grappling with, in families, when a child is addicted or there's a member of the family who's addicted because of alcohol abuse, people just say they are mad and they are so on. And now we've all begun to learn that it's actually a disease. How much emphasis are you putting on that for families to understand that they actually need to seek professional help to support that family member?
Yeah, so also, you see, mental health in our African context is stigmatized because they believe that only the respiratory system, only the chest, only your stomach can get sick and not necessarily your mind or your head. So we are determined to change that, to make people understand that mental health is health. Like any other system of the body can fall sick. And one of our tasks, therefore, is to destigmatize the belief that mental health is something to be frowned upon. That's why for us, we do not use the word junkies, because we are contributing to stigmatizing some of our young people have been affected by this. So through public awareness, through discourse, through the church, we hope that we can change
the narrative.
Yeah. To change a behavior is a long-term idea or project, Dora. It can't happen overnight. So we have to continue. We have to continue to talk about these things. We have to go everywhere. And we can rely on experts such as yourselves to help us communicate better, to reach out to a lot of our citizens to change their behaviors around alcohol consumption, especially this illicit, which is killing them, which is sending them to China, which is fueling crime, which is fueling HIV and AIDS infections, particularly among our young people, which is fueling gender-based violence. Okay, all these vices, which is actually affecting their health, liver diseases, strokes,
because
cancers,
of alcohol,
related, all these things. Yes, you see. So we need more work.
As you said, I think that you need to come back often to this podcast so that you update us on the work you are doing, clearly this is just an introduction, that there are some
Exactly.
people out there like yourselves who are concerned about illicit alcohol. I think sharing some of these statistics, some of this data is helpful, because now we put into context that almost over half the respondents were really non-functional in the research that was carried out. And I think it drives the point home that this is a serious problem. So thank you so much for agreeing to come on the program. And we will continue to spread the message on Rise Above Junta.
Sure.
Say no to
Junta.
To junta. For those of you who are watching, the statistics are frightening. As I said earlier on, 71% of the alcohol on the market is illicit alcohol, meaning that every time you take it, you're endangering your own health, your own future, the future of your family, and most of all, the future of your country. As Dr. Kalila said, this is not a fight for one group, one person, one family. It is a fight for all of us, and we need to recognize that a lot of young people have fallen prey to this problem, even in our schools, and it needs a multifaceted effort, but we can't give up. And this is why on this podcast, we thought that it is important to give time to this very important topic on abuse of illicit alcohol. So thank you so much for watching today. Again, we don't take your time for granted, because we know you could be doing so many other things. As I say always, let us remember to be kind to one another. Thank you.